questions at all, you can always email our Unicity staff and we will answer any questions that you have. And there's an email address. It's science@unicity.com. Science@unicity.com. If you use that email address, you can ask us any questions. We answer about 100 questions every week from all around the world. Can we mix BioSlife C with BioSlife S? Or should we drink it separate? Okay? So can we mix them together? You can mix them together, that's fine. But when you look at the data for cholesterol control and glucose control, it would be best, if possible, to take them separately. Okay? You can combine them, but the Unicity Science recommendation is to take them separate. Now, the question is, should I take BioSlife C or BioSlife S if I need to take them separate? Which one? Well, it depends on what your need state is. Depends on what your need state is. Now, what if I want to lose weight? Weight loss is a side effect of bringing our metabolism back into balance. And metabolism can be thrown off of balance by both too much cholesterol and too much sugar. So it depends on factors. So what if I have family history of high cholesterol and my diet is very high in lipids and fats? Which product should I take? C. Very good. Now, what if I have a history in my family of hyperglycemia and diabetes, and my diet is very sugar-rich? S. Slim. Yeah. What if I need both? What if I have history of both? Then you take both. You take C for lunch, S for dinner, S for lunch, C for dinner. Switch off. Does that make sense? Okay, good. But the question is, can we give these products to people with cancer? And I want to extend this further. Can we give our products to people who have had stroke, who have Alzheimer's, who have epilepsy, who have etc., etc. Can we give our products to these people? Here at Unicity Science, we follow the guidance of government agencies, of Food and Drug Administration, FDA, which says that anybody with a pre-existing medical condition should consult with their doctor before taking any nutritional supplement. We support that. Because here at Unicity Science, we're scientists. We're hardcore metabolic health scientists. We design the best products on the planet to maintain human metabolic health. We are not medical doctors. We don't prescribe drugs. We don't see patients. Okay, so when someone says, can we give our product to someone who has cancer? What type of cancer? How long have they had cancer? I don't know their medical chart. Who knows that? A doctor. So a medical doctor, they know the patient history from the time they were this high. They know what medications they're taking. They know what type of cancer they have. They know if they're going through chemotherapy. They know all of these details. So the medical physician is in the best position to give individualized advice. Okay? So, people who want to take one of our products, what we recommend they do is they go to their medical doctor and they say, hey, doctor, you know I have cancer, right? And I show them BioSlife C. And I say, doctor, is it okay if I take, look at the ingredient list, fiber, Is that okay for my condition? Vitamins and minerals, phytosterols, chrysanthemum, is that okay? And what you'll find is when you talk with doctors, most of these things are just fine, right? Is it okay for these different things to take vitamins and minerals? Yeah. Fiber? Yeah. Phytosterols? Yeah. But we need to talk to our doctor. Okay? Does that make sense? And the answer is yes. Yes. 12 years old, they can use BioSlife C or BioSlife Slim. Younger than that, we would have them work with their medical doctor. Okay? But taking half a dose or whatnot should be fine. But again, children, products for children should be consulting your doctor. Now, what about pregnant or nursing women? Can they take our products? You should consult with your doctor. And that is because when a woman is pregnant, her physiology changes dramatically, very different. And some women become diabetic, right? There's lots of things that happen when a woman is pregnant and nursing. And it changes from pregnancy to pregnancy. It can be different for every child. So, is it okay for a pregnant woman to take fiber? Yeah. Vitamins and minerals? Yeah, no problem. But, again, we don't know the specific conditions. So, the woman should go to their OBGYN doctor and say, I'm pregnant, doctor, so can I take fiber? And what will they most likely say? Yes, of course. Can I take vitamins and minerals? Yes, of course. Can I take phytosterols, compounds from fruits and vegetables? Yeah, no problem. Okay? Okay. Of all the studies done on our Unicity products, is there any side effects noticed? So BioSlife C, BioSlife S, are there any side effects noticed? Yes, there are side effects. Get ready for the side effects. Weight loss. That's a side effect. Bring our metabolism back into balance. Another side effect. Total cholesterol, down. LDL, down. Triglycerides, down. HDL, up. Fasting blood glucose, down. HbA1c, down. Those are side effects of bringing our metabolism back into balance. Okay? Now, there might be some initial discomfort in taking large amounts of fiber, right? So this is a fiber product. These are fiber products. And so there might be some constipation or some digestive discomfort in the first few days of using this product. That's because this is a hardcore product. And most people are not used to taking good amounts of fiber. Mother Nature wants us to take fiber. We need to take fiber. But in the modern processed diet, fiber's been taken out. So when we take BioSlife, there might be an adjustment period to work into taking this product. Okay. Let's see here. Okay. This question says, if a person reaches their goals, their weight loss goals, do they need to continue taking these products? So let's say I have high cholesterol and I take BioSlife C, and after 90 days, like we see in this study, my cholesterol is normal again. So what does that mean? Does that mean that BioSlife C I should just throw away? Get rid of it. I don't need to take it anymore. Are we good? No. We should take this product, you should take this product every single day for the rest of your life. This is a metabolic health product. It's your metabolic health insurance. Okay? Product that you should take every single day for the rest of your life. So the fact that you're seeing great results when you take this product is a manifestation that you need to continue to take the product. Okay. Let's see here. That is all the questions. Starting on Unicity, should one stop taking their medical prescriptions? Oh, so if I'm joining the Unicity business and I want to take BioSlife C and BioSlife S, but I have medications that I'm on, should I grab those medications and throw them in the garbage? No. You should still be taking those medications, but you should work with your medical doctor. And in relation to BioSlife C and BioSlife Slim, we have seen some cases where people who are on metformin and other and statins and other pharmaceutical drugs, they have been able to go off of these drugs eventually, but they work closely with their doctor. They take these products, and the doctor says, "Whoa, we take a blood test. What have you been doing? Wow, I see your cholesterol levels, your glucose levels are a lot better." And the people say, "Well, I've been taking this product." And they say, "Wow, that's great." And they come in again 3 months later, and they say, the doctor says, "Whoa, you're still doing great. Wow. These drugs have statin drugs and whatnot, they have side effects. So I wonder, what if we can let's try lowering your medication a little bit." And so you do. And then they come in a few months later and say, "Whoa, you're still doing really good. What if we try to lower it a little bit?" And that happens, little by little, working closely with your medical doctor, people can go off these drugs. But again, medical doctor, crucial. Our products FDA approved. All of the ingredients that we use in all of our products have GRAS approval by the FDA, which means they're generally recognized as safe, which is the highest approval that the FDA gives in nutritional supplements. So the FDA, government organizations, they have different rules for pharmaceutical versus nutraceutical drugs. We use all of the regulations, all the guidelines for formulating, producing, and testing our products as they do in pharmaceutical companies. We run clinical studies, as you've seen, on our products. Do we have to do that? No, we don't. In selling a nutritional supplement, you do not have to provide clinical studies. But we are a science-based company. We run clinical studies on every single product we develop. What types of sweeteners do we use in our products? And in some of our products, we use stevia. We use sucralose. Sucralose is a wonderful sweetener, has great science behind it. It's a preferred sweetener for diabetics, actually. Has no impact on glucose. We also use fructose in small amounts. Fructose is the fruit form of sugar. So there's different forms: fructose, sucrose, galactose. We use fructose. But all of our products, very low on the glycemic index. Now you might ask, why do we add any sugar? So we add a little bit of sugar to some products. Why add sugar? It has to taste at least somewhat good, right? Compliance. We're all about compliance. You could have the best product in the world, but if it tastes unbearably nasty, people aren't going to take it. So we need to compromise a little bit, and once in a while that means we add a little teeny amount of a sweetener.